It's a great privilege and pleasure to have Dr. Moez Khakiani with us. And Dr. Moez Khakiani is a well-known name for his clinical acumen. He, as an educator, as an author, as an entrepreneur, and of late you might have been seeing his creative monitor where he has been what you can say deconstructing a lot of complex prosthodontic concepts. So I'm going to read out his one of the most, what you can say, illustrious bios I have read, with more than 350 keynote podium lectures delivered and more than 5,000 dentists trained so far. Dr. Moez Khakiani enjoys his private practice, Smile Masters and Jaw Joint Matters at Bandra, Mumbai, with a special focus on TMJ and full mouth aesthetic rehabilitation. Dr. Moez is also an author. He has authored two books titled Clinical Fixed Prosthodontics Starter Volume and Clinical Fixed Prosthodontics Master Volume. I had the proud privilege of being a small part of that great book, very, very popular book. And now the third part of Dr. Moez is he's a great entrepreneur. As a co-founder of MIK Dental that undertakes designing and manufacturing of novel dental products, Dr. Moez has 7 patents registered under this domain. And we all know how enthusiastic and energetic speaker he is when it comes to his domain and his area of expertise. We are all eager to listen to his lecture. Moez, the floor is all yours.
Rajiv sir, thank you so very much. It is an absolute pleasure and an honor to be introduced by you on this lovely platform. Yes, it is 9:30 at night, but that does not mean we lose our tempo. Sir ने मुझे आधा घंटा दिया है, half an hour, and I have 55 slides to present to you during this time. So I am not going to go into any prelude. I am going to jump right into the topic, friends. I love to call this title TMJ A Calling. Alright, कहते हैं ना ऐसे मंदिर में यार तुम्हारे बुलावा आता है तभी तुम जाते हो. तो this is hopefully my way of introduce a calling to you so that you can open up the door to the temporomandibular joint and start looking for patients that you can treat. All right, now you don't have to compete with your next door dentist on root canals or crowns. You can compete with them on treatments that they do not offer, that is to do with orofacial pain. Now, सबसे पहले अगर कोई बोलता है ना TMJ, तो everyone thinks TMJ means problems only and only related to the joint, but that is not the case. I'm going to open up Pandora's box for all of you all, friends, as I introduce to you my first slide, which is titled, Who is my patient? Let us recognize that if there is a problem with the temporomandibular joint, problems are not just related to the joint, but they kind of extend beyond the joint space, which is why I have taken a beautiful picture that has been designed as a part of my book that Rajiv sir just mentioned about. And here I'm going to enlist not just the very obvious ones as to who is your patient. We know when it comes to mouth and teeth, people who have limited opening or discomfort in the temporomandibular joint, who have clicking or grating sounds, are obviously my TMD patients. But guess what? If you have a patient who complains of headaches, all right, these could be forehead or temples. These are classic areas, temples, forehead or occiput, or the common sinus kind of pains. Guess what? These patients probably can be treated by you, all right, because this is manifestation of a bite-related problem beyond the oral cavity, which is why patients who have chronic headaches, where all other branches of medicines have said, no, this is not a problem we can treat, or has been labeled as migraine pain, guess what? These patients don't need pharmacotherapy, they need dental therapy. If a patient says that I have pain behind the eye, retrobulbar pain, I have burning sensation in the eye, I have a feeling that my eyes are popping out, but they're actually not. If they have extensive amount of photophobia, which means sensitivity to light, again, dental treatment might help relieve their pain. If your patient has hissing, buzzing, or ringing sensation, something that we call as this constant buzz, right, that you feel inside the ear. And I'm going to address this aspect as we move forward. If someone is saying that I have a constant itching feeling in the ear, but the ENT says there is no problem. If a person is feeling giddy or has vertigo, ENT rules out that this is a ear related problem. Guess what? They will often refer a patient to us as dentists saying possibly a joint problem. Yes, we as dentists can treat these patients. You don't have to be a specialist. Even a general dentist, if he or she understands what the problem is in a position of managing it as well. A lot of patients with orofacial pain also come with cervical issues because this is to do with head posture, your atlas and your axis, the two most important cervical vertebrae. All right. So patients who come in with spondylosis, neck pain, or who say I can't move my neck, or it's stiff, or it just hurts, be it neck, be it shoulder, or be it even the lower back. Even patients who have throat related issues who say I have this feeling that there's a constant foreign body stuck there. Guess what? We might be able to help relieve the symptoms for these patients, which is why the next question is very important. Why should I learn about TMDs, friends? Because patients are out there, they don't know you can manage them. Forget they don't know. We ourselves did not know for the longest of times that we could manage these patients as well. That is why, friends, it's extremely important that we pay some dividends, some importance to understanding what temporomandibular joint disorders are and how do I go about managing the same. So the most important thing is where, as a clinician or someone who's managing these patients, begin. And it all begins with understanding